Do it.
Again, like I just said, this is my Aunt Cookie. You guys, come on down real quick. Cookie, you come
Mom
too.
and Cookie, do you mind coming down?
Now here's the thing. We're going to give them a very special Mother's Day present. Restylane and Radius injections. And you guys are gorgeous. Come on up here. Now, you don't have very many wrinkles, and we're not going to say how old you are, but I'm 37, so we'll do a little math here.
35.
Yeah.
Hi, when you had her.
Come on over here. So stop that. So, but you don't have a lot of wrinkles anyway. I mean, you're very, very lucky. You guys have great genetics. But what we did, we've already done this, and I guess let's just bring out our plastic surgeon.
Yeah.
Oh, let's go over there.
Do you want to go there?
Let's go
Dr. Rizk, you remember him from a few weeks ago? And he injected some of our viewers with Restylane. He's going to do the same thing today.
Hello, Doc.
How are you
How's
there?
it going? Good.
Let's start with Mama, and then Aunt Cookie will be next.
Okay.
What have you done to my mother so far, Doctor?
Well, your mother basically has a numbing cream on her face.
Okay, and you did that earlier.
Nothing else.
How do you feel? Do you feel numb?
I feel like I've had about 15 martinis. I just can't talk.
You are talking a little funny, Erica. So now, we talked about this last time. Tell us the difference between Restylane, Radius. First of all, what's the difference between Botox and those two things?
That's a very good point. Just to recap, Botox is a muscle relaxant. We use it mostly in the forehead. So for forehead wrinkles, for crow's feet, you can use Botox.
But that paralyzes the face a little bit.
You don't put that much to paralyze. You can put less, and it won't be paralyzed, but it will give you a very natural look.
Okay.
Now, Radius and Restylane are fillers. So the best place to put those fillers are around the mouth, where you see the first signs of aging, in the lips, and a little bit under the eye. Now, last time we talked about Radius not being a good filler under the eyes, but better around the mouth in this line. Restylane is a clear gel, so it can be placed around the eye in this thin area. It rejuvenates this line, and we're going to rejuvenate the area around her mouth and also her lips.
Is there any particular area? My mom hasn't ever had anything done. Is there any particular area that you were really, and you started to look at yourself in the mirror and go, oh man, like for me it's the crow's feet?
Nope, right here.
That's
this, especially this area here and right through here.
They call that the marionette line.
Yes.
And it's like,
Yeah, the marionette
I'm a
line is
major
right here.
marionette.
Well, you know, as we age, this whole area just droops, and what happens is, if I push down like this, you could see the marionette line and this fold developing, and it's the first area of concern for women.
But we heard, with
men.
Julianne, we're talking about that Restylane, the big thing now is that it might create collagen?
Yeah, there's a big, you know, ideas and studies show that Restylane creates inflammation. Inflammation promotes collagen increase in that area. So actually, your own body's collagen can also be produced.
So you ready for this? We're going to do a little injections on the air.
Bring it on.
So while you're doing that, let's just talk about well, I don't think we should talk about the pain because that's probably not a good thing to talk about right before she gets it done.
It won't be as pleasurable as a massage.
Yeah. She doesn't like massages though. So
that's good.
I love pain. Bring it on.
Doctor, what's it going to feel like? You just,
Little pricks.
just that's it?
But she's been numb topically, so she's not going to feel much.
Okay.
Where are you going to start, Doc?
I like to start around the mouth.
Mother, keep your head straight.
Okay, don't
She's
move.
just like me. I swear, this is where I get it.
So
Making all sorts of dirty comments. All right, so while you do this, the side effects of these, and there are some ladies who are getting this stuff done as well, some people sitting in our audience. The side effects, at least initially, some people, doctor, and you can just say yes or no, tend to do maybe a little teeny bit of bruising for a day or so, but it doesn't seem like that's a common thing.
I would say very little bruising.
Little bit.
See, your mom has not taken aspirin, Motrin, or reliever, or any blood thinners. That's very important not to get bruising.
Now, because you say this is a filler, this would almost instantaneously take effect then,
The
right?
result is immediate. Yes.
Wow.
So she'll be great for Mother's Day.
Well, that's good because we're flying down to Key West right after the show.
Can she
nice.
fly right afterwards?
She can fly, and if she's going to Key West, she'll be okay in the sun.
Oh.
Yes.
It's a very common question that patients ask.
These injections are what, $750 to $1,000?
About $750 to $1,200. Radius is a little more expensive. Restylane is a little cheaper.
Where do you get, how much? $1,000 we get your whole face done?
About $1,200.
$1,200 for the whole face.
When you say the whole face, I mean basically the areas around the mouth.
Yep.
And around the eyes.
And how long does it last?
It lasts about 6 months to a year. Restylane, on average, they say 6 months. Radius, a little bit longer.
And we'll bring her out at the end of the show. So you continue. So doctor, describe kind of what you're going.
Basically, I'm going right into the crease, right under the skin, in these lines. Are you feeling this much, or?
I'm feeling it.
Yeah.
Are you?
How bad is this?
It's
honestly?
not bad at all.
Not bad at all. Okay. So actually, I kind of am doing one side. You can see the differences.
You'll be all right, Cookie. Maybe we should take you on our little trip with us, Cook. You should come down there too.
Now, who all would do this? Raise your hand.
Oh my gosh! Oh, there, come on. They're all raising their hand. They just don't want to do it on the air. I like the fact that this lasts for like 6 months because Botox. How long does that last?
Botox lasts for 3 months.
3 months.
Botox is most effective in between your eyes, in the crow's feet, and in the forehead.
But the Botox is a totally different thing.
Completely different thing.
This is a filler.
You know, there's a lot of confusion.
Spackle.
The first thing that patients ask is, do I need Botox or filler? They don't really know the differences. And it's very important to make the differences clear that Botox is a muscle relaxant. And it will not make you look fake if done properly. It's actually a very good thing.
And that's the thing. I think a lot of women go out or a lot of people go out and they'll just keep on getting, and you start getting addicted because you do it and you see that you look good, and then all of a sudden everybody's like, let's do it every week.
Now, are men doing this Restylane thing, the filler thing?
Yeah, men are doing it much more commonly. I would say the average increase in men in my practice is about 20%. I do Botox myself in between my eyes.
Do you?
Yeah.
You look good, Jack.
He's 18 years old.
Well, what?
No, not quite. I wish.
No, 108.
What would be a downside to Restylane, let's say, what you're putting in, Eric?
Well, you know, I have not had an allergic reaction. It's very, very rare. It's a natural sugar. It's hyaluronic acid, so it's very rare to get an allergic reaction. I don't really see any downside. Maybe sometimes you get little bumps here and there, but you can massage them in.
Maybe the expense for a lot of people, that's way too much money.
It's much cheaper than surgery.
Yeah.
When you figure out how much you spend on creams for the face over time, it's actually cheaper than that.
I'd love that if our insurance would cover this.
Yeah, I know.
I'd be getting it every day. Doctor, does insurance come into play? Could I make up some reason why we need this?
Now you can't.
Insurance doesn't cover that, no.
Well, I need it for the show.
Oh, that's true.
Oh, yeah,
Right.
but still.
There's a lot of young bucks trying to come up behind me, take this away from me. Right, doctor?
If insurance would cover it, I wouldn't be able to fit the amount of patients in my office.
Oh, that's for sure.
And you are, I mean, we kind of made a joke out of this today. It's Mother's Day. Let's give them a present. But you are finding that this is something that has become a lot more common for people to give us presents?
Yeah, you know what I find is very common? Mother's Day gifts, also husband, wife, you know, anniversary gifts, birthday gifts, that kind of thing.
Doctor, you go ahead and finish up with Erica. We're going to see her at the end of the show. Cookie, backstage, you'll have yours done, okay? And then we'll pick out as many people as want to have some injections. Or maybe have about 4 or 5 of you.
We got some moms out there.
Okay, you all go back in the green room. We'll just have an injection party back there with the doctor and continue on with the show. We'll show you the results at the end of the show.
Please welcome back
Dr. Rizk. Hey, Dr. Rizk, come on back up here.
How are you?
Good, good.
Wonderful, doctor.
Good. How are you?
So you had, I think, 4 audience members. You had Aunt Cookie.
Yeah, we had 4 audience members and Cookie
and Erica. Juliet's mom, of course.
All right. Well, I think we should just bring them out.
Let's go. Come on, Erica. You want to come out?
Okay, let's see what she looked like. Let's see what she looked like. Hang on, Mom. Let's see what she looked like.
Oh, there she was. And now here she is right now. Okay, Sarah, put them back up there, the 2-shot again, the before and the after. Here we go. There she is right now.
There's the...
Oh, I got to tell you, that's looking good, doctor.
Yeah.
So let me point out some things.
And all this stuff, she's a little
bruised, yeah.
Little bruises.
Right.
But the face is a little puffy, so it goes down a little bit.
Puffy, goes down a little bit. Now let me just point out some things. Around her mouth, the fold between the nose and the lips, that's been filled. I picked up her lip a little bit. I gave her sort of an arch here, a Cupid's bow, so it gets a natural upper lip. And also I filled her lower lips from the corners. I filled the marionette lines a little bit, and also a little bit in the crease under her eye that develops when the eye bags puff out when you get older. So basically I was filling this crease here, in through here, there, and there.
And how long does it take for a little bit of the swelling to go down?
A couple hours.
A couple hours.
Yeah.
Yeah, I can feel the swelling in here.
A little swelling.
It'll be a little lumpy.
Puffy. Yeah.
Okay.
Yeah, that's normal.
Look at this camera.
Over here, right there, that one right there, camera 3. Okay, line her up.
There we go.
Yeah, that's something.
All right, so.
Hey, Nancy, we have time for Cookie to come out? Okay, real quick. Here's Cookie before. Here's Cookie before, and then we're going to have Cookie walk out. There she is. Cookie, come on out here, woman. Okay, have a seat right there. Look into camera number 3, right over here. Okay. Now, see, I see the difference for sure, Doc.
Yeah. Well, if you look...
Oh, yeah.
Cookie...
They filled in, definitely filled in.
Cookie had her nasolabial folds. These folds right here filled as well. She also had her lips, her upper lip, and her lower lip. You could see some more definition. You know,
It's kissable.
it's still very natural. The lower lip is supposed to be 1/3 larger than the upper lip. She had these folds placed as well, and also a little bit under her eyes right here.
All right, Doc, thank you very much.
Okay,
Dr. Rizk,
You guys,
ladies and gentlemen.
you're going to love this.
Dr.